Hi, good morning. It's been a long time. I haven't vlogged for almost 2 months now. So now I'm back again. Again, it's Dr. Dennis Latuno. And today I'm going to be talking about drugs, adverse or side effects. I'll just discuss about sample of common drugs that we use per patient, but I'll be discussing about its potential side effects. Of course, most common one is antibiotic. Uh, in general, if you're allergic to any antibiotics, you'll have hives, wheezing, itching, and the most dangerous one is anaphylactic shock. And it also can cause C. diff colitis if you use it either short-term or long-term. Special mention is the fluoroquinolones like Cipro and Levaquin. There's a black box warning about it regarding tendonitis and tendon rupture, and also can cause peripheral neuropathy. Number 2 is hypertensive medication. Most common one is ACE inhibitor like lisinopril, benazepril. They can cause dry cough. So if you develop that, you should ask your doctor to switch you to a different blood pressure medication. And then number 2, clonidine can cause bradycardia. And then beta blockers, of course, like metoprolol, bisoprolol, propranolol can cause bradycardia. And in asthmatic patient, it can cause wheezing. And number 4 example is hydralazine, and hydralazine can cause tachycardia. Now for BPH drugs like Plomax, Cardura, this class of drugs can cause dizziness, headache, and syncope. Syncope means you passed out. And number 4, cancer chemotherapy drugs. A lot of these have lots of side effects. So you have to be proactive in asking your doctor if you're going to receive these drugs. You have to ask potential side effects, because a lot of them can cause nausea, vomiting, diarrhea, dizziness, headache, and more. And then number 5 are the PPI like Nexium, Protonix, Prilosec. Common side effect of this PPI are flatulence, diarrhea, abdominal pain, and also can cause C. diff. And regards to heart medication, common one now is for heart failure medication is Entresto, which is a combination of sacubitril valsartan. They can cause hypotension, hyperkalemia, renal failure, and also dry cough. And for antiarrhythmic drugs, amiodarone, it has a black box warning. It can cause pulmonary toxicity, hepatotoxicity, and it's also proarrhythmic. And amiodarone can also cause hypothyroidism and also hyperthyroidism. And the other proarrhythmic or antiarrhythmic drug is flecainide, usually used for ventricular arrhythmias and multiple PVCs. But this drug can cause dyspnea. Also, it's a proarrhythmic and can cause also cardiac arrest. So you have to look at its black box warning too. And number 7, for statin drugs like Lipitor, simvastatin, pravastatin. A lot of sensitive patients, especially Asian, can cause, this drug can cause myopathy, wherein the symptom you take the drug, you'll develop muscle pain and mostly weakness. So if you had sudden onset of muscle weakness or you're feeling tired all of a sudden after taking statin, you better stop it and consult your doctor. And for number 8, asthma, the inhalers, albuterol, can cause, of course, tachycardia. And a steroid-based inhaler like Symbicort, Trelegy, if you don't use it properly, it can cause oral thrush. And number 9, for NSAIDs like aspirin, ibuprofen, naproxen, long-term use can cause GI bleed. You can have peptic ulcer disease and sometimes outright GI perforation. These drugs can also cause fluid retention, so they're really contraindicated if you have heart failure and even kidney failure. And lastly, number 10 is narcotics like Percocet, Norco, oxycodone. A lot of these drugs can cause constipation and, of course, addiction potential. And if you overuse it, it can cause respiratory depression and, of course, sedation. So these are just examples of medication or drugs that we prescribe, but somehow you have to be proactive. You have to ask your doctor about its potential side effects, and if you have bad or severe side effects, you better stop it right away and consult your doctor. All right, thank you very much. It's a short topic, but it's very important, especially for patients who develop adverse effect from taking medication. So thank you very much for watching my blog, and I'll see you again next time. Again, Dr. Latuno, and goodbye, good morning, good night, and I'll see you.